Hi, myself Dr. Vivek Sasindran. Today we would be talking about ear pain. Well, I'm sure most of us would have experienced ear pain at some point in life. Now, this is probably one of the most common complaints that we deal with as ENT surgeons. Now, let's see different scenarios. A young child waking up in the middle of the night complaining of severe ear pain. This is a very common scenario. Most of the time, this child would have an associated upper respiratory infection. So what you need to understand is the fact that there's a small tube that connects the nose with the ear. So whenever you have any kind of infection in the nasal cavity, it could ascend up or spread into the ear. And this condition is what we call as acute otitis media. So a diagnosis can be made by examining the ear, and subsequently these patients can be started on medical treatment. A second scenario, patient goes swimming and then comes back and subsequently develops ear pain. Now what happens is when water enters the ear canal, or if there is moisture in the ear canal, this is a scenario which is favorable for a fungus to grow. So this is probably what we refer to as Otomycosis. So fungus in the ear. The patients can have associated ear itching and severe pain, and the treatment involves suctioning out this fungus and probably using antifungal ear drops. Now the third common scenario is seen when a person has this habit of cleaning his or her ear with earbuds. It could be keychain, keys, matchsticks, safety pins, whatever. And subsequently the patient develops ear pain. So what happens is that the ear canal gets inflamed and the patient will have severe ear pain. So this is kind of something that can be diagnosed by oneself. All you need to do is just apply pressure over this projected cartilage right in front of the ear canal and see if there is pain or tenderness. So if you have pain, it's a sign that the ear canal is inflamed. So this can again be treated with either packing the ear with some medications or with installation of antibiotic drops. Now apart from this, you can have impacted wax causing ear pain. Now generally, wax does not cause ear pain. It only gives rise to a blocking sensation. But with recurrent or repeated use of earbuds to clean the ear, the wax tends to get pushed in, tends to get stacked up, so leading to ear pain. So the treatment would be to dissolve the wax and subsequently remove the wax. Now apart from these common causes, you also have certain scenarios where the patient would experience ear pain without a primary problem in the ear. For example, someone who has a tooth issue, dental caries, could present to you with ear pain. So on examination, you would not find anything abnormal in the ear. And subsequently, the patient may have to be referred to a dentist for dealing with his dental issues. Similarly, you can have inflammation of this joint right in front of the ear canal. So where the patient would experience pain when he or she opens and closes her mouth. Similarly, if you have any kind of infection in the throat, the pain could be referred to the ear. Or if there is any kind of growth in the larynx, that again could be a cause for pain in the ear. So malignancies of the larynx. So a patient who has ear pain would have umpteen causes, and those causes where you really do not find reason for the ear being the primary cause is what we refer to as a referred otalgia. So we need to look at other areas, rule out pathologies in the other areas which could present with ear pain. Thank you.